Hello again, everyone, and welcome to the next in the series of NextGen Population Health Solutions Best Practice Workflows. In this workflow, we're going to cover closing gaps in care, in particular, bulk ordering labs. Today, as usual, your presentation team is comprised of myself, Dr. Jen Bolduck, VP of Population Health, and Brian Sowers, our Senior Product Manager. So just to set the stage, what we're doing today is describing a way to find a group of patients who require the same intervention, and then being able to take action and provide the orders for that intervention in a very efficient way. So let's go ahead and start looking at the demo system. And we are going to go to metrics. And in this case, we're going to select a practice, right? We can select the metric or we can select the practice first. Either way, Brian. So let's go to Flower City Partners. And then we're going to go to Dr. Jeff. Go, Dr. Jeff Sinclair. And we're honing in on Dr. Jeff's patient population to see which of his patients need a hemoglobin A1C test. And so Brian's going to select the quality metric here, the diabetes hemoglobin A1C, poor control UDS metric. And as you can see, we have then gone to the further stratification of patients with various levels of a hemoglobin A1C, and it also includes patients who are past due for their hemoglobin A1C or have had no test. So in this case, we're going to see how our patients are doing. Obviously, we don't know what their hemoglobin A1C is if we don't have any record of them having had a hemoglobin A1C. So let's go ahead and click on those 30 patients, Brian. And then we are going to export that list to the EHR and take advantage of this integration point that we have here. And Brian will take it from here.
Great. Thanks, Dr. Chen. Again, pretend I'm the nurse, the doctor, or the care manager, and I can come into our NextGen EHR and come into our integration touch point called the hub. From here, I can go ahead and import that list, and then I can go ahead and take a look at those 30 different patients. So I can take a look at one patient at a time. In this case, I could select all 30 patients, and maybe I want to do a bulk order for these patients for the A1C. So I can come here, have preset up radiology and lab orders here. So I can select A1C, go ahead and pick my diagnosis information. And then if I want, I can go ahead and place the order, which will put the order in the chart. If I collected necessary information, I can also choose to send it directly to the vendor, send the order out. I can also let the patients know. I can come down here at the bottom under messaging, and I can come here and send them a message. So I can have different pre-canned messages already set up, grab the appropriate message, and then when I go ahead and send this based on the patient's preference, it'll send it out via email, via text, or portal, voice message, whatever. And it also document it into the patient's chart that you send it, the date, time, and that you send it, so you have a full log of that. So again, we can do many different things. So we chose to place the bulk orders and also send out a message to the patients to let them know those orders were placed.
And the amazing thing to me, Brian, is that we can act on this so quickly, right? We can generate that list of patients, have that intelligent insight from Pop Health, and then send that list over to the EHR and generate the orders and the communication all in less than 5 minutes. So that integration point really allows a greater degree of practice efficiency and the ability to act on multiple patients at once.
We get that targeted insight and that quick action to call those patients to action to close that gap.
Absolutely. All right. Thank you very much for your attention.